Let's start today's topic with conduction and its problem. And as you can see, you must always keep in mind this wiring diagram of the heart. In this wiring diagram of the heart, it is shown that electrical depolarization normally begins in the SA node, and that the wave of depolarization spreads outwards through the atrial muscle to the atriovascular node, and thence down his bundle of his and its branches into the ventricles, and the left ventricle further divides into the left and right, and then from the Purkinje fibers to the ventricular muscle. The conduction of this way front can be delayed or blocked at any point. However, the conduction problems are simple to analyze, provided that you keep the wiring diagram of the heart constantly in mind. The electrical depolarization begins normally at SA node, as mentioned above. The electrical depolarization begins normally at the SA node. It will begin over here. Then after, the spreads out throughout the atrial muscle to the AV node. It will spreads throughout the atrial muscles to the AV node. Here is the AV node. And then after, it will go to the bundle of his, and then after, it will branch to the right and to the left. The further left will divide into right and the left, because the left ventricle is very big than that of the right ventricle. And then after, then from the Purkinje fibers, it will cover all the muscles of the heart, and the conduction will be going over here. But there can be any blockage over here, either from the SA node to AV node there will be the blockage, or there will be the delay, or either from the AV node there will be the blockage and no any electrical impulse may not go over there, or there might be delay, or in the bundle of his, or in the left bundle of his, and left from here the electrical impulse or the depolarization may be blocked or be the delay. So any delay over here is known as conduction problems. So the rhythm of the heart is usually late 2 or late B1, but not always but not always the late 2 or B1. Any ECG that shows the P wave clearly can be taken as the rhythm strip or the rhythm lead. Conduction problem in AV node and bundle of his. Beginning this, you can see here there is a PQRST segment. So again, starting here, you can see this is P, this is Q, this is R, this is S, this is T, and this is U. And here the PR interval, I have said that the PR interval is suru suru and the QT interval is suru ante. Suru suru means starting of the P wave and the starting of the QRX. So this is suru suru is the PR interval, but the suru ante means here suru of the QRX complex and ante of the T. This should have meant the QT interval. And the segment, for the segment I said straight line, isoelectric straight line, as far as straight line. So this is the PR segment and this is ST segment. A segment means straight line, no any deviations, only straight lines, isoelectric line. So PR segment, ST segment. Time taken for the speed of depolarization from SA node to ventricular muscle is always denoted by the PR interval. So in the heart, you can see here the time taken. So this forms the depolarization spread through the atrial muscles will be denoted by the P wave, and the time taken from the SA node up to the point where the ventricular depolarization will be conducted is known as the PR interval. So from here to here in the AV node, this is from SA node to AV node is denoted by the P wave, and the time taken from the AV node to the starting of the ventricular depolarization will be known as the AV node delay, and the starting of the QRX in depolarization is known as PR interval. So to make it clear, the starting of the SA node up to the atrial depolarization, and the beginning and up to the time when the ventricular depolarization will start. From here the ventricular depolarization will start. So from this to SA node to AV node, and then the delay, including the delay of the AV node, is known as the PR interval. So the prolongation of more than 220 millisecond, or taking that, if it takes the time more than 220 seconds to go from SA node to AV node and to the bundle of his and starting of the depolarization, if it take more than 220 milliseconds, then this will be considered as the heart block, and will define primary, secondary, or tertiary degree heart block depending upon the situation. So usually they are not more than 220 millisecond, or the 6 small square box. As you can see over here, this one will show 40 millisecond, and the 4 5s are 1 2 3 4 5 4 5s are 20, 200 millisecond, and 1 2 3, so this will be 200 millisecond. So 1 2 3 4 5, 1 2 3 4 5, this will make the 1 second. 5 large square box will make the 1 second of time interval, and then that means the 1000 millisecond divided by 5 equals to 200 millisecond. That will be the 1 large square box, and the one small box will mean the 40 millisecond. And for the PR interval, we will have up to the maximum of the 6 box. 6 actually 220 millisecond, that will comprise of the 5.5 small square box. It is hard to identify 5.5 small square box in this, so the up to the 6 small square box we can consider the starting of the P wave, and the beginning of the Q interval up to here. Up to here, then we can consider it as the normal, but any deviation, if that starts, but any deviation like this, even after the 6-7 box, if it goes here, then this will be termed as the delay. But starting here, this will be considered normal, because this is the less than 220. So there it is the 6 square box, 6 is 240 millisecond, but our diagnosis, if it is more than 220 millisecond, then this is 1 2 3 4 5 6 7. Here will be 7 box, that will make 280 millisecond, which is more than, so this will be termed as the AV node delay. So this is a hard block, because any interference with the conduction process is known as hard block. And this, what is this block? This is first degree hard block. Why this is first degree hard block? Because depolarization originates from AC node and the conducted to the ventricle, like I have said, and then but delay along the conduction pathway, only the delay and only the delay, no any other pathology. There is only delay, there is P wave, there is Q wave, there is everything alright, but there is only delay. Then this is known as first degree hard block, as you can see over here. So P QRST, so PQRST, 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 PQRST. So let's count over here. What is the box? Starting suru starting for the PR interval. So what is the number of box? 1 2 3 4 5 6 7 8. So 8 box, 8 small square box, 8 small square box, 8 small square box equals to 40 into 8 to the 320 millisecond, which is greater than 220 millisecond, or also you can more than 6 small square box, 6 small square box, 8 small. So this is PR interval. So this is the node, there is hard block. And the next, here you can see, here is the starting of the P wave, and here is the starting of the Q wave. So 1 2 3 4 5 6 7 8. So this is also, there is also delay. Here is P, here is Q. So 1 2 3 4 5 6 7 8. This is also delay. Here is the starting of the P wave, here is the starting of the Q wave. 1 2 3 4 5 6 7 8 9. This is also delay. 1 2 3 4 5 6 7 8 9. This is also delay. There should have been less than small 6 square box, which is less than 220 millisecond. Actually 5.5 small square box will represent the 220 millisecond, but it is very unusual to see count over here, so that we make the average of 6 small square box. But this first degree hard block is not that much of important in clinical significance, but although it can be a sign of, it is not itself a very complex disease, but it can be a sign of coronary heart disease or coronary artery disease, acute rheumatic heart disease, digoxin toxicity, and electrolyte disturbance. So this is all about the conduction problem in AV node and the bundle of phase in the concept of first degree hard block. The second degree hard block. Sometimes excitation completely fails to pass through the AV node and bundle of phase, and this is known as the second degree hard block. While looking upward in the heart, so here you can see is that here is the SA node. The SA node will go out towards the AV node, depolarization, the wave of depolarization, because the muscle contraction will get the wave of depolarization from SA node to the AV node, and that will form the P wave. And there will be the further little bit of delay to get the depolarization wave to the bundle of phase, and that delay to the bundle of phase is known as it's shown by the PR interval. But the PR interval doesn't denote from here to here. This is not the PR interval. You might be wrong, because this is PR segment, this is not the PR interval. The PR interval always starts from the suru and suru, beginning of the QRS of complex to the beginning of the P wave. So from here to the here to here, this is known as PR interval. But only from here to here, it is known as PR segment. This is PR segment, while this all is the PR interval. And in the blockage, we'll be seeing the PR interval, not the PR segment. Okay. And now you can see here, there are 3 variations. Movich type 1, which is also known as Wenkevich, Movich type 2, and 2:1 or 3:1 or 4:1 conduction hard block. That may be 5:1, 6:1, that may vary. So these are the 3 variations of the second degree hard block. And now let's discuss about the Movich type 1, Wenkevich hard block. So there will be the progressive lengthening of the PR interval, and there will be the failure of the atrial beat and conducted beat with a shorter PR interval than just before. So what does it really mean? Okay, let's clarify this. This means there is P, then there is PR interval, then Q, R, S, T. Here's P, this is further, sorry, then there will be P, then there will be further starting, then Q, R, S, T, again P, then further lengthening of the PR interval, Q, R, S, then T, again P, then further prolongation of Q, R, S, T. Then what happens is here the P will come, but it will not be able to generate any QRS complex. Then the P, then comes again QRS T, then again P, then again it lengthening P, QRS T. Okay, so again P, again lengthening QRS T, again P, again QRS. So like this goes on. So what is happening over here is, let's see, PR interval. So this is PR interval over here in this segment. This is PR interval over here. This is PR interval over here. And you can see this is PR interval over here. So what you can see, the PR interval is progressively increasing in the each cardiac cycle. So this is meant by progressive lengthening of the PR interval. With the failure of atrial beat, means what here? Here you can see there is P interval, P, and it is going PRRR, but we cannot say this PR because there comes another P wave. There is no any QRX complex over here. There is no QRX complex form. So this is known as the failure of atrial beat because the atrial beat is unable to make the ventricular depolarization. So progressive lengthening of the PR interval, progressive lengthening of the PR interval, failure of the atrial beat, because this atrial beat is not able to make any QRX complex, no any ventricular depolarization wave is found because the next another atrial depolarization has been found. So this is the failure of atrial beat. And the conducted beat, the conducted next beat, this is failed. The new atrial beat has started, P wave, QRST. So conducted beat with a shorter PR interval. So you can see here it progressively lengthening. But now you see here it is again PR is very short. And again you can see over here PR is increasing in size. So again you can see PR is lengthening, but this is short, lengthening. So conducted beat with shorter PR interval than just before. This means the conducted beat is shorter than just before. So this is the Mobius type 1. Now you can see that in the ECG over here. You can compare this over here. So you can now compare this over here. So this is the P, this is Q. So this is the starting, and this is the starting of the QRX complex. So how many blocks are 1, 2, 3, 4, 5, 6? This is normal. This is not the block. Okay, this is PR interval, but this is little bit long, but not that much of long. And now next QRS T. Now you will see here is P and here is QRS T. So this is the starting point, this is the starting point. Here is 6 small square box. Any square box? 1, 2, 3, 4, 5, 6, 7. 7 small square box. And now in the next we'll see of the P, and you can see here starting 0, 1, 2, 3, 4, 5, 6, 7, 8. So 8 small square box. Now you will see here the P, and it goes for in the source of R, QRX complex, QRX complex. No, there is again the P wave. So this is P wave. Here is no QRX complex. So progressive lengthening of the PR interval. This is the progressive lengthening of the PR interval, and there is one non-conducted P wave. There is one non-conductive P wave because the atrial beat has been failed to form the ventricular depolarization. And now you can see here the P and here is Q. So how many boxes are there? Let's see over here. 1, 2, 3, 4, 5, 6. So 6 small square box. And again you see here. How many is from here? 1, 2, 3, 4, 5, 6, 7. 7 small box. And here you can see 3, 4, 5, 6, 7, 8, 9. So again it will be forming progressive lengthening. But you can see here the next conducted bit after the failure of the one conducted P wave, the next conducted bit has a shorter PR interval than the preceding conducting bit. Here is 8 cm, here is 6 cm. So it will try to form. So delay, further delay, failure. So again delay, further delay, further delay. So this is what it means by the second degree heart block, or when Quebec or Mobius type 1 degree heart block. This is the Mobius type 1. This is Mobius type 2. In this type of heart block, there will be the beat conducted with a constant PR interval, unlike the Mobius type 1 in which there will be the progressive lengthening of the PR interval, and unlike the first degree heart block in which there will be delay in the PR interval for the depolarization of the ventricle. Here the beat will be conducted with the constant PR interval, but occasionally the arterial depolarization will have no ventricular depolarization. For example, this is the P wave. You will have the constant Q, R S T. Okay, P Q R S T, P Q R S T. But P, then again on there will be the P and Q R S T, P Q R S T. Then again P, then again P Q R S T. So this is the second degree heart block. There will be no progressive lengthening, and in the first degree heart block there will be the delay in the PR interval, but the QRX will be followed. But here there will be no QRX complex, no QRX complex form, but the PR interval will be at the regular interval. And to see in the ECG, you can see over here, there is PQRST. So PQRST, PQRST, P. Then there is nothing. Then again another P. So here the ventricular depolarization is not being followed by the atrial depolarization. So QRST. But you can also see there is no any progressive lengthening or no any delay. PQRST. Then PQRST, 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 PQR. Okay. Here you can see this Mobis type 2. Mobis type 2 heart block. And here in the next another, you can see over here, here is the type 3. It is the type 3 of the second degree heart block, which is 2:1, 3:1, or 4:1. And there will be the alternate conducted and non-conducted arterial beats. That means the one conducted arterial beats, then 2 to 3 non-conducted beats. Twice or thrice or 4 times P waves of QRX complex. And always keep in mind that P wave may only show itself as distortion of the T wave. So P wave may also show as the distortion of the T wave. I will explain that over here. Here you can see there is P, and here is QR and T. Then here is P. Then there is another P. So here you can see 1P. So here is P. Here QRX complex, then T. Here you can see another P. But there is no QRXT, then there is another P. And this is QRX complex, CT, and here is P. So this is distortion of the T wave. Here along with the T wave, you can see there is the formation of the P wave. Here is P, P, QRX, and this is T, P, P, QRS, T. So here is another P, and here is again another P. Here is also there has been no any QRX complex, no QRX complex. Here is T, QRX, P, P. Here is no. And here QRS, T, P, P. So here is P followed by 2P at the same rhythm. At the same rhythm, followed by 2P, 2P, then QRX complex. So this is the 2:1. 2P, then QRX complex, 2P, QRX complex. If there had been 3P, like in this format, and QRX complex, then it would have been 3:1, or there had been 4P, then QRX complex, then that would have been 4:1. So atrial conducted and non-conducted atrial beats. So alternate conducted and non-conducted. Non-conducted, there is conducted, non-conducted, non-conducted, conducted, non-conducted, conducted, non-conducted, conducted, non-conducted. So alternate conducted and non-conducted arterial beats at the regular interval, twice or thrice or 4 times P wave per QRX complex. Here it is 2 times, here it is 3 times, and here is 4 times per P wave per QRX complex. And always keep in mind that P wave may only show itself as distortion of the T wave. So you can see here distortion of the T wave. Okay, so this is mean by the 2:3:1. Also, you can see over here, P wave in the T wave can be identified because of its regularity. Here is P, here is QRST. It's another P. Here is another P. Here is QRX complex T. This is also T, and this is P, P. QRX complex. Then this is T. Then here is P. Okay, so this denotes here is P. This is P. This denotes here is P. This denotes here is P. But there is no conduction. P but no conduction. P but no conduction. But you have to be very careful to look at this, because this is being hidden. Because the P wave in the T wave can be identified because of its regularity. Because this is the 2:1. As this is the 2:1 heart block. Here P, 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 P. So 2:1, 2:1, 2:1. So this is the 2:1 type of heart block, second degree heart block in the third type. And then there comes the third degree heart block, which is the complete heart block. And the complete heart block means there will be the from the SA node, the sun will go, and from the AV node, but from AV node there will be no going of the any depolarization or any wave. Any wave will not be going over there. So where does the ventricular, so do ventricular depolarization occurs or not? Yes, they do occur, but by the escape mechanism. That means there are some depolarizing focus in the ventricular muscle that will give the electric impulse, and that will cause the ventricular depolarization of the muscle. So it will be not associated with the SA node or AV node. It will be doing by on its own. So we can see that ECG over here. So you can see that ECG over here. Here the no relationship. Okay, so there is no relationship between the P waves and QRX complex, and QRX complex and the abnormally shaped QRX complex are present over there because of the abnormal spread of depolarization from the ventricular muscle. So this is the P. So this is P. There is no QRX complex. Here is QRX complex, but this is of somewhere else. So there is again P, but no QRX. Here is P. Here is P. Here is QRX. Here is PP. Here is QRX. Here PP, but it does not follow that pattern. Okay, what it should have been following. So this is the third degree heart block, in which there will be the atrial contraction is also normal, but there will be no bit conducted to the ventricle, as ventricle had no option but to lead to the depolarization by the escape mechanism, that is from the depolarizing focus that is present in the ventricular muscle. So this is all about the heart block.